everything makes it into the headlines, but we bring you the full story. Join Uchenna Cyril Anyoke, a renowned media personality and former president of the Nigerian Publishers Association, as he unpacks the real issues behind the news, from politics to public policy, economy to human rights. Nothing is off limits. Expert guest, in-depth conversation, local and global perspective. New episode every week on Facebook and YouTube. Watch now on Freedom Square TV. Follow for updates and behind the scenes clips. Beyond the headlines, beyond the news.
Good morning. You are watching Beyond Headlines of Freedom Square TV. And of course, we are reaching you from our Enugu studios. For those who may not know, Enugu is the capital of Southeast Nigeria and is also known as the Coal City State. Hypertension, commonly known as high blood pressure, has become one of the most dangerous non-communicable diseases affecting millions of people worldwide. Every year, the world marks World Hypertension Day on the 17th of May to raise awareness of a high blood pressure and encourage people to regularly check their blood pressure numbers. The day was established by the World Hypertension League to educate the public on the dangers of hypertension, a condition widely known as a silent killer, because many people living with it often show no symptoms until serious health complications occur. Similarly, in Nigeria, health experts continue to raise concerns over the increasing number of adults and even young people living with the condition, many without knowing it. Hypertension, often referred to as the silent killer, usually develops quietly with little or no symptoms while causing gradual damage to vital organs such as the heart, brain, kidneys, and blood vessels. In many cases, people only discover they have hypertension after serious complications like stroke, heart failure, kidney failure, or sudden collapse. Medical professionals identify several contributing factors, including unhealthy diets, excessive salt intake, stress, lack of exercise, obesity, smoking, alcohol consumption, and hereditary factors. Experts say regular blood pressure checks and healthy lifestyles remain the most effective ways to prevent and manage the condition. This is why health campaigns across the world continue to emphasize the message, know your numbers. Today's discussion seeks to educate the public on the dangers of hypertension, the importance of early detection, and practical steps individuals can take to live healthier and longer lives. On today's edition, we are discussing Know Your Numbers, defeating the silent killer. And here we shall be examining what hypertension really is, the causes and warning signs, why regular blood pressure checks are important, the dangers of ignoring your numbers, and practical ways to prevent and control high blood pressure. Of course, my name is Uchenna Cyril Anyoke, and I'm still your host. And I'm being joined this moment for this very important discussion, or if you like, conversation, by a renowned medical expert, consultant cardiologist, past president of the Medical Women's Association of Nigeria, and of course, the immediate past chairman of the Nigerian Medical Association in Enugu State. Our guest is Dr. Esther Ekwe. Doc, good morning and welcome to Beyond Headlines.
Good morning, sir. Good morning, viewers.
Okay, it's actually a pleasure to have you, and quite a lot of people are, so to speak, undergoing some kind of challenges with BP. That's what they normally call it, BP.
Yes.
So we'll start from the basics. When they say somebody is when you say hypertension, what does it exactly mean, and why is it called the silent killer?
Thank you very much for the question. Yes, hypertension is one of the most important non-communicable diseases we have in the world. It's a burden, it's a high burden disease. Of course, you have said that it is a silent killer, and that is why it is very important. Hypertension occurs when the pressure in the arteries are very high, too high to, to supply blood to vital organs of the body. It's actually defined mostly in terms of numbers. Yes. And there are different guidelines like the Joint National Committee on Hypertension, European Society of Hypertension, and others. I understand that this is not a highly academic exercise. So I'm going to bring it down to the level of the layman,
Of the viewer.
of the
Yes.
viewers, so that they can understand really what we are talking about. So, simply put, when the blood pressure is less than 140/90, that is normal blood pressure. It's actually a range, right? So we don't want it to be more than 140/90. Like I said, I'm going to keep it simple.
But some people worry after 130/80.
That's why I said it's a range from, basically, in our own clients, from 110/70 to 140/90 is acceptable. Although there are certain cases, that they require a particular, value, like in diabetics, people with other comorbidities, you want it to be, keep it strictly at 130/80, 120/80. But generally, it should not be below 110/70, and it should not be above 140/90.
Okay, so you are saying is that for our client, that the black people or
Black
Africans,
people and
that
Africans and Nigerians.
sometimes I've had a case where I have 130/85, and doctors are telling me you're hypertensive.
It depends on your other things you have. We call it comorbidities,
Okay.
like diabetes. All right, people who have diabetes, they keep their range at 130/80. People who have other things like arteriosclerosis, peripheral vascular disease, they all have their, tight control values. Call it tight control values. Not that if it is slightly above or below that it is not normal. Yes, but due to their own guidelines, it should be tightly controlled at particular numbers. Some would say 120/70, 120/80. Diabetics 130/80. The important thing is that it should not go beyond that, because when it goes beyond that, it begins to cause target organ damages. The kidneys will begin to be affected, the eyes and other things, the blood vessels, the nerves will begin to start being affected, and that's another sickness of its own.
Okay, if a viewer, maybe one of these guys who are helping us now, maybe Peter, maybe Chamaka, maybe Vigut, goes to a pharmacy and then checks his blood pressure, and it is 190/180, what do you call it? 140/90.
Yes.
Which automatically means he has hypertension.
Not really. I thank you for that question. Yes, because for you to say that someone has hypertension or high blood pressure, that person's blood pressure must be checked under certain conditions.
Okay, what are the
The
conditions?
conditions are, the person must have been seated and rested for some time, some minutes. The person must not have consumed a stimulant like alcohol, caffeine, or smoked, or been under stress. It can be someone running from outside into a room. You just grab the person and sit the person down and check blood pressure, and it's high. You don't say that the person has high blood pressure. And when you get that value for high blood pressure, it must be sustained over time, right? It's not by checking it once. It must be checked in at least in two different positions: sitting down or and standing, or lying and sitting. There are reasons for this which I don't want to go into because that will lead us into the scientific and pathophysiologic basis of hypertension. Now, that blood pressure, that high value that you got, must be gotten repeatedly under the same conditions before you say that the person has high blood pressure. You know, as we move around our daily activities, our blood pressures don't remain the same, they fluctuate, and it is normal. But when you are rested, you know, and it's checked in a well rested position and it continues to be high, that is when you now say that the person has high blood pressure.
How does chronic hypertension force the heart muscles to change? And why is that dangerous?
Well, chronic hypertension means that the heart is working, you know, against high resistance over time. It's just like, let me liken it to a typical situation that you will understand. You know, when people build muscles, those that go to the gym and they do repeated exercises, they keep building the muscles, and that with repeated exercise the muscles keep expanding. It's the same thing that happens when the heart keeps pumping against, you know, high resistance over time. It begins to increase in size, it begins to hypertrophy, it begins to expand. It is likened to that exercise that people do that build muscle. Remember, the heart is also a muscle made up of muscles. So that muscle, by that continuous push against high peripheral resistance, the heart now gets big. That's how it happens.
Okay.
Yes.
So, what is the direct link between uncontrolled hypertension and stroke?
Very good. You know, we had talked about hypertension being a silent killer, and the reason is because it does not give symptoms. The first symptom of high blood pressure might be the symptom of the complication it has. And these complications include stroke that you just talked about. Blindness can cause blindness, can cause even, you know, high tension, pressure, intraocular pressure, which, you know, can lead to glaucoma. That is, in fact, glaucoma is the high blood pressure of the eyes. So it can cause, I don't know if we're going to come down to complications as a question, or I should just take
Just go ahead.
Okay, fine. Can cause kidney failure. Okay, can also damage the blood vessels and cause peripheral vascular disease. Okay, and so many other things that it can cause. Now, talking about the link between it and stroke, if that high blood pressure is in fact it's the high blood pressure of the brain that can, which can lead to bursting of the arteries in the brain, that is stroke. You know, when that pressure keeps building up in the brain, it's so much that the, you know, the arteries are fighting. Normally, under normal circumstances, God has made it that our blood vessels will be kind of, you know, soft, malleable. They can expand to contain, you know, the pressure. But over time, when they get overwhelmed, they can actually burst if the blood pressure is so high, and cause what is known as hemorrhagic stroke. I said hemorrhagic stroke because there are other types of stroke that you can have that is not from high blood pressure. So that is the direct link between it and
Okay.
stroke. Yes.
There's a common thinking or thought that high blood pressure is the natural part of getting old, meaning that younger ones cannot have it. Is that true?
No, no, no. In fact, it's a myth now. That used to be the case. It was thought that high blood pressure is the disease of old people. But I can tell you now that even more more and more younger people are coming down with high blood pressure now. In fact, there's a there's an estimate, of a study done even in this Enugu, that in young adults, that adults from 18 years to 40 years now have high blood pressure. And that study done in Enugu is as high as 21.3%
Adults in Enugu, yeah.
of young adults are down with high blood pressure. And mind you, many people that have high blood pressure don't even know that they have it. There's a very high level of unawareness or low awareness of high blood pressure. And that's also why it's a silent killer. In fact, the first symptom of high blood pressure can even be sudden death. It's as bad as that. So, because you can see from my explanation that it is when the blood pressure is checked that you will know that you will have high blood pressure. I tell you, some of us here, a lot of us are moving around with very high blood pressures, and it doesn't stop them from doing anything. But they either collapse, or they have a stroke, or they have heart attack, sudden chest pain, and they breathe their chest, and that is heart attack. And a lot of more and more young people are coming down with heart attacks as a result of high blood pressure. I'm sure you must have, noticed sudden death. So more and more people are collapsing and dying in our clinics.
So, is it genetic?
Yes.
You can inherit it?
You can inherit it. In fact, in the classification of blood pressure, it's basically classified into primary and secondary hypertension. That primary hypertension is the one that is inherited. There are other classifications, so many. Well, we're not doing an academic exercise.
But you can explain a bit of it.
Yes, that's primary, which used to be known as essential hypertension. But the nomenclature changed because the word essential was perceived as something being necessary, being important, But we know we don't want, it's not essential that we have high blood pressure, or important that we have it. So it's now primary and secondary. That primary one is the one that runs in families.
Okay.
That is the one that is inherited. If someone's parents are hypertensive, there's increased chances that the person will be hypertensive, come down with hypertension somewhere along the line. All right? And it's not always the case, but most times it can occur. Then the secondary hypertension is the one that is caused by other things like kidney disease, peripheral vascular disease, atherosclerosis, okay, and arteriosclerosis. There's atherosclerosis from the build-up of cholesterol or bad lipid plaques in the blood vessels that narrow the lumen and now make it, not malleable anymore, and the resistance is now increased, and you now need more force, more pressure to push blood through those vessels to supply the vital organs of the body. Now, there are other classifications, like I said, the ones caused by maybe even pregnancy. There's something known as pregnancy-induced hypertension.
Yes.
Some people were not previously known to be hypertensive, but when they are pregnant due to the hormonal changes in the body, they start having high blood pressure during that pregnancy. Some of them go back to normal after delivery. Some continue to be hypertensive from that. Okay, there's high blood pressure as a result of what is known as pheochromocytoma, which is a tumor of the adrenal glands, the organs, small organs seated on top.
So you have many types of.
There are so many types, but what should concern us in this discourse is the primary and the secondary.
Okay, I often hear about sodium. Sodium, and let's say it's a major enemy to blood pressure. What actually is sodium, and where it is typically hiding?
Where is it hiding in the body?
The body. So what is sodium? Yes, people hear sodium, sodium, sodium.
Sodium is actually salt.
The one that guy gets in.
The salt that you and I use in cooking, that is salt. Your everyday cooking salt is sodium. Okay, now um, these are some of the risk factors to hypertension, because we have talked about the classification and all whatnot, but there are factors that predispose one to having hypertension, such that even if you don't have it running in your family, there are certain lifestyle things that you do that will predispose you to it. We have talked about old age, and we now say that, in fact, it also occurs in the young. Another important thing is diet, and that is where this sodium you're talking about comes in. Poor diet. Poor diet includes when people are eating maybe foods high in salt, high in saturated fat, like what's it called? Oil. I'm bringing it home.
Yeah.
The oil that we use in cooking, when you expose it to room temperature, the good oil should not clot.
Yes.
I'm sure some of us have seen that some oils, when you keep them at room temperature, maybe overnight, you see something like a lard, something is congealed, the oil is congealed, a thick, this thing sitting on it. That is saturated fat. Also, the kind of fat you see in fatty meat, areas of meat, that is not good. This sodium, it's not like you should not eat salt at all, but there's a certain amount allowed per day. It's about 2 grams or so.
That is 2
But
grams.
that is why
How does the village get 2
that's
grams?
what I'm coming to that. We don't go weighing our ingredients in this part of the world. So when you say 2 grams, it's about a tablespoon. And not that you scoop it to build up and be high. You have to level it. When you take your salt, you scoop the top. That is about 2 grams of salt. Now, not many people will go doing that when you're in the heat of cooking and you want to go to work or somewhere. So what we advise
you can do to all the food now.
So what we advise is no added salt or putting when you cooking. I mean, virtue lies in the middle, and moderation is the watchword. You have put that amount you feel that it's okay for the food. When you finish cooking the food and you're eating the food, don't start adding salt, because I see some people, you give them food, they've not even tasted it. The first thing, they start putting salt on top of it. And it's not, that is the one that causes high blood pressure, because we black people, we handle salt poorly in this part of the world. That is why even in the course of treatment, we are mindful of the medications we use. There are medications tailored towards that. Okay, let me go back to the diet, because that is where the meat is, the big elephant in the room actually. After sedentary lifestyle, the next thing is this diet. We should also take foods rich in fruits and vegetables. Part of the treatment for high blood pressure is lifestyle modification, and in that,
Is that what you call DASH?
Yes, that's what we call DASH diet. That simply means dietary approach to stopping hypertension. What it simply means is that we are encouraged to take foods that are rich in fruits and vegetables, and we have to make conscious effort to do that in this environment, because fruits and vegetables have become very expensive these days, and we are told to also include whole grains, low fat diet like I've said before, lean proteins like proteins from fish, deskinned poultry, meat, turkey, you remove the skin. Then plant-based proteins like beans and legumes, we call it lentils. Okay? Then nuts are good sources of um, antioxidants. Okay, that we're encouraged to take that because they are good sources of fiber. Fiber is good. Okay, in this environment we have some vegetables in season. Let us eat those ones in season. They are very you know easier to get and very affordable. But like I said, you have to make conscious effort to do that. We are so encouraged to avoid you know what's it called, added sugars, include sugars. We talked about diabetes here. Okay. Also for men, well, and women too, limit alcohol intake. Yes, right, also to limit alcohol intake. But these are the factors that predispose people to hypertension, and of course sedentary lifestyle, which will lead
we'll
to
come to exercise. But let me ask you, what's the relationship between hypertension and sleep apnea? What you call poor sleeping, poor
Yes.
sleep. What's the role between sleep apnea and high blood pressure?
Yes, sleep apnea is a recognized cause of high blood pressure. You see, the sleep apnea, those people that snore when they are sleeping, okay, they have excessive fat in their airways that makes them, not to sleep well. So there's frequent awakenings. When somebody is well rested, relaxed, and has slept well, the blood pressure tends to come down in the morning. Okay? But when there is repeated interruption of that sleep pattern due to frequent awakenings from sleep apnea, they suddenly wake up in the night when they can't get enough air and they start gasping, and within a short time they lapse back into sleep, and that obstruction occurs and they jump up again. You see, there's so much interruption of that sleep. So when the person wakes up in the morning, you slept but you didn't really sleep.
How can we prevent that?
It's a sickness of its own, and there's treatment for it in the hospital. There's a treatment for it. They give CPAP, something that will open up the airways and allow oxygen to flow freely and allow the person to sleep well at night.
Okay. If, for example, if you are want to lower his or her numbers through exercise, what type of exercise and how much exercise do they need?
Okay.
If you want to attempt to, they say part of lowering BP through exercise.
Yes.
So how can that be done? What kind of exercise would you recommend?
Yes. I'll break it down to elements. We want people to exercise regularly, and there are different types of exercise. There's something called isotonic exercises. You know, basically, we encourage walking. Brisk walking is enough. Those who can jog should jog, but you don't advise an elderly man or woman to go to Obara Square and run a marathon around that field. The person will collapse. So normal brisk walking up to 30 minutes a day, not less than 3 times a week. If you can do that every day, fantastic. But it shouldn't be less than 3 times a week. And it should be sustained, and it should be regular. Not when you do today, you will not do for 1 week. You will now do again. Maybe when you now want to do again, you now over exercise because you want to make up for the one you did not do. No, it doesn't work that way. It should be brisk, and it should make you sweat. And when you sweat, you're also losing salt through sweating. Okay, sometimes after exercising and person did sweat, when the sweat dries up, sometimes you see whitish cross on the skin. That thing is salt. See some coarse particles on the skin. That thing is salt. So when you sweat that way, it opens up the blood vessels for free flow of blood. That is, and the salt that person has lost is also a good way of lowering the blood pressure.
Okay, just for emphasis, what is actually the correct way? Because most people say they check their BP, they don't check it properly.
Mhm.
You mentioned, but what is the correct way for you to measure blood pressure at home to get
Yes,
an accurate result?
yes. Before you should be rested. In fact, at home, it's better to check on waking up from sleep because you have not exercised, you have not taken any stimulant, you have not done anything that will raise your blood pressure. On waking up, sit down, relax, deep breathing to calm you down. Then you must have the appropriate blood pressure apparatus. Okay? There is the electronic one and there is the mercury one type. They are all good if you use them properly. And the cuff is that thing that you tie on your hand before measuring the blood pressure. There is an appropriate cuff for the adults and there is one for children. So make sure you are using the appropriate one that will cover up to the 2/3 of the hand. Yes. There's also a tube coming out from that cuff that connects it to the blood pressure apparatus. That tube must overlie your elbow, the front of your elbow, not be positioned. Sometimes there's a marker on that cuff as well. They should be over the elbow. The reason is that the brachial artery, where it's a major artery there where the blood pressure is taken, should be that cuff should cover it. Then
Okay.
you check.
Okay, so for those who are watching, you must know how to measure. It's not just tying the thing and then pressing the button. Just from what you said, you have to get relaxed.
Yes.
Early morning checks are very, very important.
Yes. And the apparatus, if you are using the electronics one, should be at the level of your heart. You should lift it up or place it on a pedestal or table that's approximately at the level of the heart.
So if you keep it like something like below
No.
here.
No, you would get a wrong reading. If you keep it above, you get a wrong reading.
Okay, so
There
if I'm
is
measuring,
reasons for that.
you have
Lift
to.
it up, yes. Someone can hold it for you or you hold it with the other hand. Yes.
Okay. You talked about dash diet and what we call a lifestyle changes. So when this is not enough, when it is not working, when it has failed to work, how do you decide it's time to prescribe medication?
Yes, you have already said it is when these lifestyle modifications don't work that you now go for medication. But remember that part of the lifestyle changes is avoidance of stress. Yes, I know that we are in a very stressful environment. I don't know how one will avoid stress in Nigeria of today with all the things that are happening around us. But one has to make a conscious effort to avoid it or at least limit it as much as possible. Try to be calm when driving. You see a lot of road rage. People are very angry because of what is happening in the country, and they go out with that anger. And especially when driving, things that should not be a problem are problems. Now you see a lot of emotional outbursts, outbursts of anger over there. People don't queue up to do anything. All these things contribute to high blood pressure. And then inordinate ambitions, people who try to, be what they are not or to get the whole world in one full sweep. It makes them, go overboard in trying to make ends meet or to get that which they, long for. All those things are forms of stress. So we have to make conscious effort to bring it down. Then smoking, there's no nutrient in smoke. Yeah, I'm very funny now. Same with alcohol. If you are already smoking, the advice is to quit, not to reduce. Quit smoking. But for alcohol, if you are already drinking, we advise that you cut down and gradually quit. If you are not already drinking, please don't start. I know if it were a phone-in program, people will start asking me or telling me that after all, the Bible says that a bit of alcohol is good for the heart. Yes, I know, because it's what I hear every now and then. And this is, that's not a justification for someone to go out drinking. And some will tell you, when we say you're allowed 1 or 2 drinks a week or a day, there are units for men and women, and we say at a sitting. Some people will tell you, okay, if I do 2 drinks at a sitting, I will change position and do another 2 drinks. I will change position and do another one. It's self-deceit. By the time they finish changing position, they've taken 10 or more drinks per day, and you see, they are not obeying instructions. They are just exposing themselves to the danger of high blood pressure and other non-communicable diseases.
Patients worry about side effects from the medication they take. Like, what are possible side effects if you continuously keep on taking your prescribed medication? And then there's a question coming from that. Sometimes people will say you need 2 or 3 different pills instead of just 1.
Okay.
So how does it work?
How it came about?
Yes,
Yes.
taking 1 may not be sufficient. Okay, yeah.
Yes. The reason is because the medications work through different mechanisms.
Okay.
Now, depending on the cause of that high blood pressure, the doctor or caregiver will decide the medication to use, also bearing in mind other comorbidities that the patient has. The medication you give to somebody who has straightforward hypertension without other comorbidities like hypercholesterolemia or diabetes or peripheral vascular disease or even stroke, and the one you give to somebody with maybe okay, just as I said, it is what is happening to that particular individual at that point in time that will determine the medication you will use. Sometimes, or most times, more than 1 medication is used because of the way they act at the points, at levels in the body that they act. Some act by helping you lose salt and water, losing fluid. Some act by helping you, shed weight for those who are obesity or who are obese. Some act by lowering lipids, the bad lipids in the body, like the cholesterol and all whatnot. Okay. Some act by dilating the blood vessels and making more room for blood to flow. That is why you have different medications, and each medication has its own side effects. In fact, virtually everything, every chemical substance has side effects, and drugs are chemicals as well. So if each medication has side effect and somebody is taking more than 1, some take 2, 3 or 4 depending on the circumstance, you can imagine the side effect, the combined side effects of each of the medications that the patient will experience it. And those side effects in their own will be a different illness altogether. Some can come in form of dizziness, tiredness, excessive urination, okay? And this can be discomforting to individuals. Can imagine if you are taking diuretic, you know, to control your blood pressure, and you have to take it in the morning, and you are traveling, and you're on transit. You can imagine the discomfort. You keep saying driver and all that. You understand? So that is why we preach lifestyle modification first. If you do it, believe you me, if you do it properly,
you may not need medication.
You may not need medication. And you know, some of these medications cause erectile dysfunction, which is a big issue in our environment. Can you imagine that a full-fledged man, it's a concern, whether we like it or not, we're faced with it on a daily basis. A full-fledged man, you know, an odogu, and you can't get it off because you are taking blood pressure medication. Some of them will say, "Kiara Pugodogwa," you know, and achieve other things. After all, something must kill a man. This is what we hear every day. Just like when they go to eat and they say, "Go out in the evening, you see what I'm talking about. Madam, nye m isi ewu, nye m nkwobi, nye m abacha, nye m kanda," and all sorts of things. Liver, somebody is one person. Intestine, they say roundabout. This is what all in one plate. It's not part of the food though. This one is a side attraction. They heap it, and of course there has to be alcohol to wash it down, you know. And that's when they will tell you, "Come on, God, don't take order for after all, nkonyeli kobu." And all those things are going into the body and causing abdominal obesity. There's obesity and there's obesity. Obesity in itself is bad, but worse is abdominal obesity or central obesity. That is when you begin to see pregnant men all over the place. Somebody is seated and the tummy is lying on the laps. We see these things now. So that is, you see that kind of person is a time bomb that is, you know, waiting to explode. That person will have hypertension, no doubt. We have dyslipidemia. We have all manner of things, and may later come down with stroke or even heart attack.
Sometimes when people who have high blood pressure, at some time they get somehow the numbers return, and then they stop checking, or they say, "Okay, maybe you checked for 1 week and it's returned," and then they stop. Is that a mistake or is that normal? Or is that what? How would they watch it?
Thank you very much for this question. This is what we see every day in our clinics. And sometimes, partly I blame some of our colleagues who don't do due diligence when they come in contact with these patients. Before you start a patient on medication, you must explain to the person the reason why you're starting medication. It is because other measures have failed. And when you start medication, there has to be compliance or adherence. You educate that patient properly so that both of you will be on the same page. If not, what you just said will play out. Because if my blood pressure is high, and you give me a medication and it comes down, why should I continue taking that medication? More especially when I'm experiencing a barrage of adverse effects or side effects from it. That is what leads to people stopping their medications. But when you educate that patient that there's need to continue taking your medication, because the medications are made in such a way that When your blood pressure come to a normal level, they get stabilized. They don't really go below. They are made in such a way that they don't go below what is normal, as long as you're keeping to prescription. However, if there's a case where that blood pressure or a danger that it can come down dangerously low, you reach out to your doctor who prescribe that medication, and the dosage will be tapered. There's even a case where you need to remove some of the medications and keep the person on just one or two. So what I'm saying is that it is not good to stop taking drugs when you feel better. You have to go back to the doctor, because after seeing you, the doctor will normally give you an appointment. It is for him or her to check these things, how your body is responding to the medications, and they will be altered. At this juncture, I must, warn that there are people who don't go to the doctor. Maybe in a case of a spouse, both are hypertensive, one is on medication, one is not. Then the one that is not on medication will start taking medications prescribed for the spouse.
For the spouse.
As after all go BP, I ain't jam with BP. You go and take this person's own. It is wrong. Or somebody's brother or sister is hypertensive and is taking high blood pressure, and you yourself, you have not gone for proper evaluation, because before you are given medications, you'll be investigated. Proper history will be taken by a qualified personnel. You will be examined to check for other things. Then you will be investigated. You will be sent for lab tests, even scan. You will be scanned. Your heart will be scanned by an expert. These are the things that will shape the type of medication or treatment that you will be on. Okay? So going to take another person or my friends, you are in a meeting or in the church or in the vehicle, and the person whose doctor has prescribed medications for, having evaluated the person properly, pours out a pill and takes. And you haven't seen a doctor, but you know that you are hypertensive, but it is not preventing you from carrying out your daily activities. Because the other person is taking pills, he's saying, which is very wrong.
Okay, low BP.
Mm-hmm.
So which one is low BP? And how dangerous is it?
Yes. I'm sure you must have heard that low BP is more dangerous than high BP. Yeah. It's very dangerous, actually. In fact, some people call it low hypertension.
Low hypertension.
Yes. If high one is hypertension, low one will be low hypertension now. Yes, indeed, it's a very dangerous thing to do. It's even easier to manage high blood pressure than the low blood pressure, because by then, if it's dangerously low, the vital organs are no longer being perfused, and the person starts shutting down. Yes, the person will have end organ failure. Just as high one will also cause that with time, but the one of low blood pressure is more rapid. And you know that we don't have the culture of people first going to hospital when they are sick here. I go do things again within the house, and the thing is still going low. And by the time you come out, there's no transportation, and if you get transport, the roads are bad for you to get to the hospital quickly. And it's not that person that is sick at that material time that will drive. Person may feel dangerously dizzy and won't be able to drive. Before you even get someone to drive you to the hospital, it's a problem. Then you get to the hospital, the protocols are what we know.
So what numbers indicate low BP?
It should not be below 100/70.
It should not be below 100/70.
Yes, or 60.
Okay.
Yes.
So when it gets, you have 90/70.
90/70 is bad. 90/60 is bad.
Okay. Okay.
80/60, 80/50. Anything below 100/60 is bad. It should not go. Don't even allow it to be 100/60. Once it's 100/60, you go and see your doctor. Don't take your BP medication on that day, but go and see the doctor.
Okay. We should be actually winding down. Um, I'm sure. Is there any information you want to give that these questions have not covered? Because you are an expert here. Is it you can do that in what I call a central message.
Yes.
If viewers must take one central message away from this conversation, what would it be? What would be a kind of summary of what somebody who is watching you, somebody who just jumped now to watch
Mm-hmm.
and didn't start from the beginning, what message, what central message would you give to a viewer?
Okay. In summary, hypertension is very common. It is with us and it affects all age groups. It's a global burden of disease. Up to 1.4 billion people in the world have hypertension. Up to 35 to 40% are living with hypertension in Enugu State. And individuals between 18 and 40 years old are highly affected. This year's World Hypertension Day theme says, controlling hypertension together. Check your blood pressure regularly. Defeat the silent killer. High blood pressure is a silent killer because it does not show any specific symptom. It is only when you go and check your blood pressure that you will know whether it is high or not. And this check must be done under appropriate conditions like we have enumerated and by a qualified medical personnel. Remember, when left untreated, hypertension can cause stroke, blindness, heart attack, kidney disease, and even untimely death. So, we are raising awareness for early detection of high blood pressure, prevention of risk factors, and control, while encouraging collaborative efforts at individual, community, and health system levels to fight against the disease.
Thank you so very much, Dr. Esther, a cardiologist, former president of the Association of Women Doctors.
Medical Women Association of Nigeria.
Okay,
Yes.
and the immediate past
Chairman.
of Nigerian Medical Association in Enugu branch.
Yes.
It's been quite enlightening, and I'm sure our viewers are better enriched. So, to our viewers, hypertension may be silent, but as the expert has said, the damage it can cause can be very devastating. So, what do? Check your blood pressure often. Encourage your loved ones to do the same. Live healthy life. Seek medical attention early. That's what she told us. And so if you do those, we want to thank you. It has been Beyond the Headlines of Freedom Square TV. As always, stay informed, stay healthy, and stay alive. Remember to follow us on our social media platform using the hashtag at freedomsquaretv.com. Thank you for being a part of this, and join us same time tomorrow for yet another interesting edition of Beyond Headlines. Have a lovely day ahead of you.